Ladies and gentlemen, we have come to a period in time where doctors can intentionally end the lives of their patients. The recent euthanasia bill has passed the first reading, and soon patients throughout the country could have the choice to end their life. As the end of a person's life approaches, they may experience some discomfort along the way. The reason for the patient's request for euthanasia are not entirely based on physical pain, but due to a fear of being a burden or feeling socially isolated. This is exactly the case in Oregon, as 49% of those receiving legal assisted suicide in 2016 cited concern about being a burden as a reason. In the rare 4% of cases where the pain medication does not work, a person can be sedated. Therefore, death is not the answer to physical pain that patients may be feeling. Intentional killing is dangerous and could be abused by the doctors, the families, or the government. In 1990, 1,030 Dutch patients were killed without their consent. 22,500 deaths were caused due to withdrawal of support. 14,000 were denied medical treatment without their consent, and 1,700 were mentally competent but were not consulted at all. Now, this may be due to several reasons from the different parties. For example, let's say if someone was to inherit $1 million by the death of their elder, this would give them probable cause to kill that person, and they could legally do it. Euthanasia, frankly speaking, legalizes murder for physicians and doctors. Dr. J. Forrest Whitten wrote that euthanasia would give doctors the power of life and death over individuals who have committed no crime except that of becoming ill or being born, and might lead towards state tyranny and totalitarianism. This example can be shown in a case study in 1947, when 47-year-old Ellen Hogg admitted having killed her ailing 70-year-old mother with an overdose of sleeping pills. Her excuse was that she couldn't endure her crying and misery. However, in reality, she was the one who couldn't endure her responsibility of taking care of her ailing mother. This was a very selfish reason, and legalizing euthanasia would make this completely legal and normal. Doctors are people who we can trust to save and cure us. We regard them as people who have been trained to help us and save our lives. But euthanasia gives doctors the opportunity to tinker with our lives, and most seize this opportunity. A perfect example of an opportunist would be Dr. Jack Kevorkian, better known as Dr. Death, who took advantage of his patients' sorrows and killed more than 100 people under his care. In the late 1980s, he also created a machine for death, which injected a lethal dose of medication to the patient. World War II is a terrible event in the history of the world, where about 80 million people were killed. However, over 100,000 of these people were killed in Nazis' euthanasia program. During the war, the doctors were responsible for selecting those patients who were to be euthanized, carrying out the injections at the killing centers, and generating the paperwork that provided a medically credible cause of death for that person. Euthanasia was accomplished by lethal injections, or in children's cases, slow starvation. This gives doctors basically the power to play God, and it is completely legal. In conclusion, legalizing euthanasia would give people an excuse to end their life. It will most definitely be abused by the families and doctors without even consulting the patient, and it would basically provide a legal way for doctors and physicians to commit murder. To give life the respect it deserves, euthanasia should not be legalized.